Hi everyone, my name is Julie-Munoz and I will be talking to you today about sexually transmitted diseases and infections. So there are a few things that I would like you to come away with after listening to this presentation, and that's definitely a little bit of knowledge about the different types of STIs and STDs. Now, I know that this is an extremely broad topic. There are unfortunately so many different types of infections and viruses out there. However, as some of you may know by now, I am a nurse. I may have mentioned that a few times in discussion boards previously. So again, these are just a few infections and viruses that I have seen more prevalent in the healthcare field. So I do think that these ones that I picked out to really pinpoint on really deserve some time to be taken on them. Also some background information, how they are spread, the symptoms or even lack thereof, the treatment and prevention methods, and current news. And the current news is actually pretty interesting. It's going to be talking about a medication that's out there for hopefully preventing HIV. So I'll go ahead and talk about that in a few minutes. So first, there are different types, obviously, of infections and viruses and diseases. There's bacterial and there's viral. So bacterial, a few will fall in that category, such as syphilis, chlamydia, and gonorrhea. And under viral, you can think of that as the 4 H's. So viral infections will be HIV, which is the human immunodeficiency virus, herpes, which is genital herpes and genital warts, hepatitis B, and the human papillomavirus, HPV. So again, 4 H's for the viral. And as most of you may already know, since you probably have already watched the video lecture on viruses and bacteria, infectious diseases, bacteria will be easier to treat just because they respond to antibiotics, while viral infections will not, unfortunately. So, background information, pretty interesting chart that I found. It's on new HIV diagnoses in the United States by age, and this was put out in 2016, so a few years ago, however still very prevalent in today's time. As you can see, your eyes probably immediately go for the red bar, and this is ages 20 to 29, and obviously it's a pretty big difference between the rest of the ages. And when you think of 20 to 29 year olds, you think that's college age, very early adulthood, and unfortunately this age range is known for their risk-taking behavior. A lot of people at this age, they want to try bungee jumping and extreme sports and things like that, which is great. However, unsafe sexual methods do tend to also fall into this category. So that's a pretty good reason as to why so many new HIV diagnoses are coming out around this age. So one of the methods that I think is going to be best to go ahead to try to combat this is instilling safe sex methods and lessons and education starting as early as late elementary school, early middle school. And that is because I think the earlier that we talk to our kids, as soon as they can understand what things we're referring to, of course, which is probably why it's best in middle school, but before sexual activity is even a thing for them, I think it's important to go ahead and get this knowledge base into them about safe sex methods and how to choose partners and what to look for and how to really take care of their intimate health. I think that's going to be most important to try to get these numbers down, especially for these ages. So how are STIs and STDs spread? As you all know, the main spread is going to be through sexual penetration, and that can be through different ways, which is vaginal, oral, anal, basically anything where you are spreading and you are going to be mixing bodily fluids, okay? And again, sharing needles is another thing as well. Many people think it's just sexual activity. However, sharing needles, you're cross-contaminating blood types, you're not using new needles. This is definitely a way to go ahead and share an STI or an STD with someone. And another thing that people don't really realize is sharing clothes. It may not let you necessarily obtain a viral infection. However, definitely bacterial will be high with sharing clothes, especially undergarments, even jeans, things like that, where they are coming into skin-to-skin contact, as you can see there, skin-to-skin, with somebody who may have a bacterial infection, and you may not even know it. So definitely have to be aware of that. And different clothes. You definitely don't want to share things like that. So symptoms. Tricky, very tricky with the symptoms, because sometimes you may not even know. Sometimes you can look at someone, and as with many illnesses, you're not going to know that they're sick or that they have an infection, and they may not want to be telling of that because it is a taboo subject, and they may not want to go ahead and tell their friends or family about that. So you may never know. However, symptoms that you can definitely visually see is going to be unusual discharge from female and male genitals, discomfort in the pelvis, which could be just tenderness, pain, and maybe even burning urination, definitely itching, rash and bumps around the genital areas, and painful intercourse. Now, these symptoms really overlap with many of the STIs, and STDs just mentioned. Chlamydia, syphilis, gonorrhea, things like that are going to have very overlapping symptoms. So it's very hard to tell which it is until you actually go and get tested by a medical doctor, physician, something along those lines. However, HIV is a little more severe. The symptoms can sometimes not even show up for many years, and sometimes they will show up sooner. And those symptoms usually include fever, fatigue, sore throat, swollen lymph nodes right in your neck, and appetite changes, such as losing weight. So HIV does have a little bit different symptoms as opposed to the other STIs and STDs. Now, prevention is going to be the most important, and number one is going to be abstinence. If you are not undergoing sexual activity, then you will not have or be exposed to an STI or STD. However, abstinence does not work for everyone, and that is okay. However, you do have to be responsible and safe about your sexual methods, and you should choose to, every time, if you are involving yourself in that, either use a male or female condom. Limit the number of sexual partners, because again, this will decrease your chances of spreading and receiving STIs and STDs. Or if you are with one partner, have a talk about exclusivity and monogamy. Regular physicals with your doctor is also extremely important, so that you can get regular tests for these different STIs and STDs. Another important thing is less consumption of alcohol, because as we know, the more drinks you have, the more your inhibitions will slowly go away. So you have to definitely be careful with that, and with the crowd that you surround yourself with in instances when you may be drinking. Definitely keep an eye out for that. Again, as I mentioned, do not share undergarments such as underwear or towels. And then another thing is the HPV injection that you can definitely think of. Now, this is a preventative for the HPV virus, and it should be noted that you should take this or have this when you are not sexually active yet, so that your body can build antibodies against it if it should ever come in contact with that. It's not a surefire way that you will not get it. However, it's definitely something to take into consideration. And again, most importantly, get tested for HIV if you are sexually active. So current news that I thought was pretty interesting was the pre-exposure prophylaxis, or PrEP. It is a pill, Truvada, that's the name of it, and it contains 2 different ingredients. Now, this is specifically important because you cannot be infected with HIV already. This pill is only for people that have not been infected already. However, it does reduce the risk of infection when in contact. PrEP has been shown to reduce the risk of HIV infection in people who are at high risk by up to 92%. So that is amazing. And when I say high risk, I do mean people that are not monogamous, that have multiple partners, possibly sharing needles, how maybe they do not use protection on a regular basis, things like that. And it is also important to note that this medication should be taken daily, and you do need to be tested for HIV every 3 months with this medication. However, it is a wonderful prophylaxis that I think if people do fall in that category should definitely take a look at. It is definitely some really good research out there about it. So hopefully you learned a few things about sexually transmitted diseases and infections, and I thank you for listening to my presentation. Have a good day. Bye-bye.